I'm Dr. Mapatha. I'm currently a medical officer and I'm planning to study to be a pediatrician.
I'm Professor Ratsela, Ratsela I was born here in South Africa.
Okay, I'm Nouwen. I'm an internist infectious disease specialist, 51 years old, and I work at Erasmus MC in Rotterdam.
Okay, my name is Tempelman. I'm a medical doctor by profession, trained in Nijmegen in the Netherlands, and I came to South Africa in 1990. Worked first 4 years for the Department of Health, first as a medical officer, then in medical management at the Department of Health, and then started to think about setting up a clinic on my own in an area of about 120,000–140,000 people, where there was no medical infrastructure. And it started off as a family practice, which finally became a regional center in public health.
What I know is currently for prevention, they have free condoms available. Some places have free condoms, some don't have. It's not very standard. So they try to put them in clinics, in public toilets, but you might go to a public toilet today and you might not even find it. And there's still that stigma. If you go and buy a condom today, the teller will probably look at you like, really? So you're having sex? There's still that stigma around using a condom and sex. So it's not necessarily, I would say the government in a way has failed to educate a whole lot of people when it comes to prevention. And they've tried. They have advertisements on TV about how you should prevent HIV infections, like using condoms, having one partner, or being celibate. They try, but I feel the message is just not reaching the people. I don't know why, but it's not reaching the people. And they try to have documentaries, like almost all the soapies in South Africa have a person who's HIV positive. They always have like soapies, normal everything on TV. There's always someone infected or affected, so they try and teach. So they came up with this thing that we just have to call it RBD, which stands for retroviral disease. So whenever we're presenting a patient, we would say the patient is RBD reactive, which means that they are retroviral disease reactive, they are positive. So if a patient is HIV negative, we'll say the patient is RBD non-reactive.
The government is trying to build up the the primary health care system, so that at the end of the day patients do not have to get to hospital late. They are trying to put in more resources, more money in the primary health care system by getting more nurses, more doctors to work in the rural areas, and so that they can improve the system.
In a rural area, the stigma, and this is where most people are actually affected. A whole lot. I've got neighbors, I've got relatives, I've got cousins that are HIV positive. So this is where a lot of people are actually infected and affected by HIV, but there's still a stigma. If, for instance, I'm a bit chubby, if I were to lose weight, the entire village will be talking about me. Oh, she's HIV positive. Have you seen her? So there's still that thing. People are actually still scared to go on a diet and be slim. And I can't move from here and be thin. Everybody's gonna start talking about me. And the other thing in the rural areas, you still get people, especially men. Oh my God, our black men feel I can't use a condom. How do I take a sweet? They always use this analogy. How do you suck a sweet with a wrapper on? You have to unwrap the wrapper so you can actually get the taste of this. That's how they. So for me to have good sex, nice sex, I must not use a condom. So they come to the woman and they tell them, I cannot use a condom. 1, 2, 3, 1, 2. And the other thing is, if you use a condom in the rural areas, they automatically feel you're cheating. Because the man is probably working somewhere, because most of our men in the rural areas have jobs far from home, because there's more opportunities there. So when he comes back home and you're saying, let's use a condom, he tells you, who have you been sleeping with? So most of the women, they don't want to use condoms because they're scared.
I think that every AIDS patient is a system failure. We should have found him earlier, we should have started him earlier of treatment. He should have had a better environment of becoming a patient living with HIV. And as long as we can't reach that, then we will continue to run behind the facts, and we will have to continue to accept HIV-related death. And I think the solution of the epidemic is not to be found in the Department of Health. They are running behind the facts. The solution of HIV is primary prevention, prevent the people turning positive, and secondary prevention, find them as quickly as possible, manage them as good as possible, and let them stop from spreading HIV.
I guess that many years ago, in the beginning of this millennium, people tried to promote rolling out antiretroviral treatment in sub-Saharan Africa in a situation where there was no money, there was no infrastructure, and everyone said it was impossible. So there were some people who thought it should be possible, because if you get Coca-Cola to every corner of the world, why not antiretroviral treatment? And I guess they showed that at least if you have the will and the means, you could do that, because many people in sub-Saharan Africa needing antiretroviral treatment for their HIV infection get antiretroviral treatment.
So we're not scared of HIV positive, but I touch their blood all the time. So with kids, most of the people don't put on gloves. We touch blood, we clean it, you just quickly go rinse your hands. But we're not scared of them, because that's all we work. Actually, 80% of our patients are HIV positive.
So slowly, things have changed in South Africa, I think in a good way. When we started treating the epidemic, all the money needed for it came through foreign donors, because the government didn't have the will to treat HIV. And once they started, now 10 years further, the donor dependency is about 10% of the total budget, and government has stepped in already for 90% of the budget. So there is a fantastic mind shift in politics, in public health, about what we have to make available to contain this epidemic. Are we doing it well? Yes, definitely. Things have changed, but still, in South Africa alone, there die about 900 patients, 600 patients per day on AIDS-related causes.
I think condom, that remains the major preventative measure of HIV. I think if we could do that, then a lot of our